Yay. Cool. Great. So, welcome to our second installment of our second series of a strength-based learning program. So we ran um, 6 sessions last year, which seemed to go down really well, and we wanted to repeat that this year, focusing on our understanding and our learning from the work we do as platform um, on working in a strength-based way. So people, organizations that work alongside people, how we can work with those people in a strength-based way, in an asset-based approach to getting the best outcomes for those people. Um, and the first session of our new series was really a summary of the last session. That's been recorded. So if you weren't able to make the first session, recordings are available on our website, and we'll be sharing the links throughout the morning and via email. This second session is really the core and the hub of the thinking behind much of the work that Platform undertakes. And it's around about challenging the dominant narrative of mental health. Now, I won't go into that because Sian's going to talk to us for a while about that, and I'll spoil it. Um, but for those who do not know Platform, and forgive me, won't take very long for the people who have seen this before. It's worth just having a bit of background of who Platform are. So Platform are a charity based in South Wales, have been working for 35 years. I think it's the 35th year of operation now. For me, the origins of the charity are really important. It was a reaction to the closure of a psychiatric unit in Bridgend, and a reaction from the people who started the charity of wanting to support those people leaving that unit back into society, back into work, back into housing, and helping in and sitting with people to support their lives. And I think that very root of the beginnings of the charity still remains with us. We aim to improve the services for people experiencing distress. We aim to focus on mental health, on housing, homelessness, and young people's systems, and to make those systems and encourage those systems to work better. And doing that, we advocate for an understanding of mental health with a different lens that Sian, I won't talk about that because that is exactly what Sian's going to be talking about. But to challenge the dominant narrative that we have maybe have been brought up with around our mental health. So that is kind of Platform's purpose. Um, to give you an idea of scale, we've got over 300 staff now. We're working with well over 15,000 people a year across 150 projects and services. Those are projects are as broad as crisis prevention houses, homeless services, employment
Mhm.
services, an ever-growing children and young people's team. And then the bit myself and Sian work for is a well-being team, which increasingly is moving into different spaces and is looking at organizational well-being as well as how leadership interacts with our well-being and that kind of stuff. So that gives you an overview of who Platform is. I've got a hand up from Daryl. Hi, Daryl.
Sorry, Pete. I just thought you might want to know that I'm Daryl. I work for Platform. Yeah.
Great.
Um, the Even Bright joining link doesn't work. That's why there may be only 5 people here. Yeah, I had to
Oh,
get
okay.
through. Yeah, yeah. I sent you a text. Sorry, I sent you an email. I just thought you might want to know. I'm sorry
Okay,
to
great. So
interrupt. Yeah,
Rachel sat in the background. Thanks, Darrell. Appreciate that. Rachel
yeah,
sat in the
yeah,
background.
yeah.
We are recording this, so we'll be able to share this with those that haven't been able to make it. We got 25
Great.
25 in at the
Yeah.
moment, so that's cool. Thank you,
Okay.
Darrell. Appreciate it.
Cheers.
Thank you. So I will stop sharing. I've done my kind of introduction, and I'll hand over to Sian to take us through the next 45 minutes to an hour. At that stage, once Sian's done, we are going to take a bit of a break so we can have a comfort break, just so you know it's not going to be a long slog. So I shall stop sharing, and hopefully, Sian, you'll be able to begin your bit.
Perfect. Thank you, Pete. I'm just trying to share my screen now. Um, bear with me. That's not the slide I meant to start on. Um, welcome everyone. I'm Sean. So as Pete said, I'm part of the wellbeing team. I met some of you before, I think. I've definitely met you before, Daryl. Um, so yeah, welcome. Um, I am head of training and delivery for Platform Wellbeing. So my background's psychology. And I'm going to be running the session this morning on how we understand mental health and how maybe we can challenge some of those dominant narratives. It's not going to be an hour of me just talking. The way I work is quite conversational. I think that's how we learn best. So please do talk to me. I think there's the size of the group is probably big enough that if you want to kind of contribute verbally, if you just put your hand up using the little hand up system, that's grand. And if you want to use the chat instead, that's also absolutely fine. I'll pull that up in the corner of my screen and try and keep an eye on that. But please do jump in. Um, from the very start, to be honest, because my first slide is a question for you. So we have here an image on the screen. Hopefully you can all see that. Please do let me know if you can't. Um, I'd really just like you to share with me what you're seeing here. What message is this conveying? Great. So we've got something in the chat already. We've got individual versus systemic. Thank you very much, Alex. Anyone got any other thoughts? Um, So yeah, just not accounting for systemic causes. Yeah, so things not maybe accounting for the bigger picture. So yeah, the example given here being deforestation. Um, so yeah, there's been a huge devastation, hasn't there, to the environment of this poor koala. Um, and that's maybe being overlooked in this image. We've also got victim blaming. Yeah, absolutely. So what we're seeing here is that massive devastation to the koala's environment. Um, and we've got somebody in a suit with a clipboard pointing at the koala and saying they have a mental health problem. So we're internalizing the problem. Absolutely. Anything else from anyone? Okay, so context matters we've got as well. Absolutely. So we're very much making assumptions here, aren't we? So if we look at this image, we have got two experts by the looks of things. So suits and ties, looking very professional, making decisions, labeling is things coming up in the chat now. Absolutely pointing at the koala, internalizing the problem as if there's something wrong with them. Okay, you're absolutely right in the chat. What we're not doing is asking the koala what's going on and looking at the bigger context. So as you quite rightly said, there's been massive deforestation here. So what we're seeing is a koala who no longer has a home, no longer has any shelter or safety or food. I can't see any other koalas in that image. So there's an awful lot going on for them. And rather than considering any of that, what we've got is two people saying, oh, they've got a mental health problem. There's clearly some anxiety in this koala, but is it a problem or is it context? Um, so well done, everyone. You've hit the nail on the head straight away. Um, so why have I shown this image, do you think? Any ideas why this is the first thing I've put on screen? So there might be some of you chatting. Okay, here we go. Stigma against mental health. Yeah, absolutely. So we see a lot of stigma, don't we? Maybe a lot of blame. Um, because we've got in the chat now, because the biomedical model is not the whole picture, over pathologizing. Yeah, absolutely. Um, so the dominant narrative around mental health, kind of more recently, has been one that's quite medicalized. So one that thinks about mental health or kind of mental health difficulties, things like anxiety, which I think this koala is probably displaying as an illness, as something that's wrong with people. Um, and that's also the way our systems work a lot of the time, is we think about labels and diagnoses and things that are wrong with people rather than things that are wrong with our environments, the environments within which we're living. And rather than trying to recognize the way we feel and the distress that we might be experiencing and some of the kind of signs and symptoms that accompany that, as actually being quite meaningful and trying to communicate like distress that's completely understandable, right? So this koala might be feeling anxious, but that's completely understandable. There is nothing wrong with this koala. There is something massively wrong with the environment in which they live. Um, and so what we can see quite often is probably how this koala is feeling right now is desperate for help, but the services within which you find that help are kind of restricted by diagnoses, and sometimes kind of got blinkers on to what's going on more broadly. So that's the narrative we're going to challenge today. And we're going to instead think about mental health as being more about what's going on around us. So what's happened to us rather than what is wrong with us. Um, and this is not just a message that kind of platforms sharing. Some of you have probably come across this before. It's a kind of message that's coming through more and more through policies. So from some of the leading experts across the World Health Organization, across the UN, it's in kind of UK mental health policy more and more and more. Because we're starting to recognize that thinking solely in medical terms isn't actually that helpful. And what we need to start thinking in is kind of thinking about is social determinants. And we'll talk more about what that is a little bit later. But trying to think about circumstances rather than curing individual disorders. So we've been quote here from the UN report back from 2017. So, this thinking isn't brand new. This has been around a while. That says we've been sold a myth that the best solution for addressing mental health challenges are medications and other biomedical interventions. But actually, what we're learning is that it's not about chemical imbalance. And that's certainly not the only solution, isn't medication. Not to say it doesn't have a place, it does, and lots of people find it very helpful. But actually, there's more to it than that. And another thing we need to think about is power imbalance. Any thoughts on what we might mean by power imbalance? Again, we will talk a little bit more about that later. I'd be interested to know your thoughts. We've got legal here, so professionals, yeah, so thinking about dynamics in relationships between people accessing services and people providing those services, 100%. Whenever we go into a service and we've got professionals and users, there's an automatic power imbalance there, isn't there? And one of the things we need to think about when we're working in a strengths-based way is how do we share that power when we can? We're not going to get rid of it. The very nature of how our systems are set up means that those dynamics are there. but how can we share power and kind of redistribute and regenerate um, power the best we can. We've also got not on but with. So yeah, not doing two people, trying to do with people. Um, so not just prescribing, but also trying to think about circumstances and what's the best option for each individual person. Daryl, were you going to say something there?
Yes, I was just going to ask a question, if I may, Sean.
Yeah, go for it.
Does this power imbalance also apply to the therapist-client relationship? Yeah.
Yeah, I think it can. Yeah,
Mm.
it's the same as a doctor-patient relationship, isn't it? It's
Yeah.
the same
Mm.
um, as going to see a lawyer or kind of anyone who's providing a service. If you're using, you're
Mm.
kind of going to an expert, and if you're the expert, you naturally hold that power.
Mm.
And
Mm.
that's not a bad thing in itself.
Yeah.
It's about how we use that power
Mm.
when we're in the position of holding it. Um,
Yeah, as a person-centered therapist, humanistic therapist, I start from the position that the client is actually the important person in the room, and I always make that clear in the first session, and that it's completely non-directive. Yeah, whereas doctors and lawyers are usually completely directive. Yeah, so I was just wondering that just struck me that maybe person-centered is different to many other modalities. Yeah,
yeah.
yeah, yeah.
Yeah, and it's like I say, it's about how you use it, isn't it? Like you
Mm,
can, you can be a doctor and yes, there is a natural power imbalance there, but that doesn't mean
mm,
that you can't still work in a way where you can share that power and actually work in a way that's really helpful and still really person-centered.
mm.
Um,
Yeah, true.
yeah,
I think in my own experience, that's rather rare, to be honest. Yeah.
yeah. Yes,
Yeah,
and there's going to be
yeah.
massive variation across professionals, isn't there? Because
Yeah.
we're all humans and we're all
Mm.
very messy and complex and very different. But yeah, no, good question. Thank you,
Thank
Daryl.
you.
Um, oh, we've got one more comment come through on power balance at the last minute. So another question. So is it also about power imbalance in the system as a whole? So people often feel powerless to change their circumstances. Yeah, absolutely. Absolutely. So if we think about kind of living in adverse circumstances, so maybe poverty, maybe not having access to the help you need, um, not meeting the right criteria or living in the right place. There's lots and lots of ways that power imbalances play out. Um, and you're right, Madeline. Yeah, it can leave people feeling powerless to change. Um, and again, it's one of the challenges, isn't it, with how our services are set up at the moment. Quite often you need a diagnosis to access the help, but the diagnosis itself isn't always helpful. So yeah, you're right. It's very complex. The whole system contains power imbalances in lots of different places. Um, we've got another comment underneath that says it's about working alongside. And I think that's actually something that's really important to hold on to. It's like what you were saying there, Daryl. There can be power imbalance, but if you're working alongside, then you're starting to share that power and work together with someone rather than doing two, you're doing with. So yeah, absolutely, really good stuff. Thank you, everybody. So if we want to rethink mental health then and how we understand it, if it's not um, solely about kind of what's happening in our bodies and what our brains are doing, how do we understand it? So at Platform, we've tried to break that down into the simplest form we could think of. Um, and how we understand it is that mental health is actually a combination of things. Okay, so it's about nervous system regulation. So there is definitely a biological element. How are our bodies reacting to stress? How are our bodies reacting to what's going on around us? But there's also a really important role for connection. So connection to ourselves, but also connection to others and the kind of larger world around us. So that's some of those systems that you were talking about there, Madeline. Um, so I'm going to talk through each of these bits of this definition. We're going to talk through what we mean by nervous system regulation, and then we're going to talk through why connection is also so important. Please do continue to ask questions as we go through, if any pop up. So, you might have come across a diagram like this before. So this is adapted from a theory called polyvagal theory. Some of you may have heard of and be familiar with. You'll certainly, I imagine, be familiar with the fight or flight response. And essentially, that's what this diagram is talking to. So what you can see on this diagram is you've got an axis up here that says arousal increases. That is essentially the amount of stress that we're under, okay? So the level of distress that we're experiencing. And we'll talk a little bit more about where that comes from in a second. And then you can see 3 stages, for want of a better word, in this diagram. So you have this green space, this orange space, and this blue space. This green space is a place of safety, okay? So it's a place where we feel able to be in the present. So we feel quite safe, we feel connected to other people. We're in a position where we can be curious, where we can learn, where we can be open with our emotions and feel compassion for other people. It's quite a nice, safe, social place to be. So green space feels safe. None of us are there all the time. If we were in the green space all the time, life would be very dull. But also, it probably wouldn't be healthy for us. So what we often see is we will follow this kind of little wiggly line here, where we will kind of trip up into this orange space and then eventually make our way back down into that green safe space. So this orange space is our threat response space. So it's the fight flight response. Are people familiar with fight and flight? Can you give me a thumbs up if you are? And essentially, our fight and flight response evolved to keep us safe, okay? So it doesn't feel very nice when it's happening, but it's a really useful system. If we didn't have that, we all would have been eaten by saber-toothed tigers a long, long time ago. We wouldn't have lasted very long at all. So when we experience a threat, our fight flight response is activated and we either move towards the threat in fight, so we try and push that threat away, so kind of get it out of our space, or we flight, which is the opposite. Okay, so I'm not going to take this threat on, thank you very much, but I am going to get out of here. So I'm gonna literally run away. How might some of those, or I guess either of those, present day to day now? How might you see some of those? Because the type of threats that we experience have changed. It's no longer saber-toothed tigers, hopefully. So it might not be a literal running away or a literal attack. How might it present instead? Again, feel free to write in the chat, but also feel free to jump on the mic if you prefer. So we've got conflict. Yeah, so if we think about fight, it might present as conflict. That could be verbal, couldn't it? Could be verbal conflict rather than physical. Anything else from anyone? How might flight look? We think about that moving away, trying to escape a threat. Could be ending a relationship, yeah, so isolating, withdrawing maybe. Absolutely. So maybe not physically running away from something, but sort of shutting off from it. So maybe that looks like taking time off work, being avoidant, either of things we have to do, places we have to go, or people we're supposed to see. Equally, fight might be more confrontational, um, potentially self-destructive. Yeah, lots of really good ideas coming through the chat. Thank you very much. Um, absolutely right. What about fawn then? Fawn tends to be the the response that people are less familiar with. So we've all heard of fight or flight, fawn less so. We see fawn often when we're not in a position to fight or flight. And there's a couple of people in the chat that have got this. Yes, it's about appeasing. So it's a much more passive response. So if we think about fight as movement towards the threat and flight as movement away from the threat, fawn is about moving with the threat. It's about befriending, people pleasing, trying to keep the peace, right? Trying to keep the threat happy so that it poses us less danger. So it's often a response we see in within relationships. So when there's relational threats, think about kind of violent relationships. We don't necessarily have the power to fight that, and we don't necessarily have the power to leave that relationship. And so what we see is fawning. That kind of tending, befriending, people pleasing, quite passive, allowing people to disrespect your boundaries. We've got in the chat, yeah, absolutely. So we lose our boundaries when we're fawning because it's not about us anymore. It's about others. Yeah, absolutely. Well done, everyone. So that's in a nutshell our orange space here. I feel like I could do an hour just on this slide, so I'll try not to and move on. And then above that we have freeze. So you'll see in this middle area we have the words I can. So that's when we experience a threat, but there's a way of us still responding, right? We can deal with that. We can lessen it in some way, whether that's through fight, flight, or fawn. In freeze, so in the blue space, when we're kind of so distressed, we get to a point of feeling overwhelmed by it. And we cannot manage that threat anymore. We cannot lessen that threat. So what happens is we start to shut down ourselves. So we might see things like real feelings of hopelessness, things like depression. We might physically start to shut down. So you see like people lose control over bits of their limbs. People might experience mutism, so lose the ability to speak. And sometimes then you'll see kind of emotional or like psychological shutdown as well. So we see things like a dissociation, which is a sort of separating from mind and body. So it feels like we're looking down on ourselves, and it's a way of trying to really minimize the pain that we feel when we're in that much distress, whether that's kind of physical or emotional. Okay, does that make sense to everybody? I'm going to assume yes, unless anyone raises a hand. So that's essentially this curve here. Can you see my mouse okay? Yeah, great. So as we experience distress, we can kind of work our way up this curve. The more distress we experience and the less able we are to regulate, so that is to bring ourselves back down into this green space, the more likely we are to kind of constantly be in fight, flight, fawn, or freeze. Everyone's still with me. So what might some of the things be then that kind of push us up this curve, that cause us to feel that distress? If we think about how we just reframed mental health, so if we think about kind of context and social determinants and power, what might be some of the things that actually cause us to experience distress? Just give you a bit of time to start typing. So yeah, here we go. So things like not having a safe house to go to. Yeah, so not having some of those basic needs met, not having a place of physical safety. Maybe experiencing abuse of some kind, so not feeling safe in kind of relationships or those that we're around. Having no one to turn to when things become bad. So yeah, not having a social network. Um, Kind of really missing that kind of connection that we all need. Um, Not having options to meet our own needs or use our own capabilities. So yeah, that's a really important point. We think about kind of maybe some of the adversities that have been mentioned, so housing, experiences of abuse maybe, or other traumas being things that push us up this curve and into distress. If you combine that with not having options or resources to meet our needs or kind of regulate, then we're not able to do this wobbly line and kind of come back down into the green. So it just builds and builds and builds. Also things like bereavement or kind of experiencing passive aggression, breakdowns of relationships, insecurity. Um, yeah, sometimes being in services themselves, so experiencing contradictory information about how we're supposed to be feeling and why we're feeling the way we're feeling, not being able to access the support we need. Absolutely. So yeah, you're all absolutely along the line, along the right lines, feeling disempowered, feeling controlled, whether that comes from kind of relational traumas or institutional abuse. Julie's added to the chat here. Yeah, there's lots and lots of things. So it's a big, messy picture, but there's so many things that can kind of push us up here. And what that means is actually we're all we're all kind of floating along a different point on this axis as our baseline. So for some of us, we might not have experienced a lot of those adversities and we spend most of our time in this green space. And for others, we'll have experienced a lot of those adversities. And so our baseline is actually in this orange space, and we might be quite easily tipped up into this blue space. And that's when we start to see some of those typical kind of diagnoses being made. So you can see some of them in here already, things like anxiety and panic. So you might be diagnosed with anxiety or panic disorders in this if you're kind of experiencing a lot of fight flight responses. And equally, if you're spending a lot of time in this overwhelm space, we can see things like depression here. We can see things like dissociation. You might start to see things like some of those symptoms we associate with psychosis. So delusions, hallucinations, paranoia. So the diagnoses that we often see can actually be explained as just responses to the amount of distress that we're experiencing. Everyone's still with me. Okay. So that's the up curve. What about the down curve then? So we've talked about activation of our nervous system and all of the things that can activate us. It's equally important to think about deactivation. And this is where that aspect of connection comes in. So to feel safe and to be regulated, we need to be able to get from this blue space or this orange space back down into this green space. And this is something we rely on others to help us with. So we first learn how to do this when we are really young. Okay, so in our first kind of attachment relationships. I think, here we go. I have a slide to help explain this. So again, some of you might be familiar with this model. It's a diagram taken from a program called Circle of Security Parenting. So it's a program that's based on decades of attachment literature, all boiled down into one handy slide. And there's three elements to this. So there are the hands here, which represent our secure base. Okay, so those hands are our primary caregiver. the person with whom we are most connected when we're young. So it's often a parent or a guardian um, when we're little. And what we need from that secure base, that person, is the ability to go out along the top of this circle, but also to come back in on the bottom. So this is about being supported to go and explore the world and experience things. So experience joy, experience kind of knocks and bumps and bruises, and to have someone who's watching over and there to experience with, but not to do for. So it's that time where you've got somebody, you've got a parent sat in a room and a kid's off looking in the play box or picking up stones or climbing trees or whatever, and having those new experiences. And some of them will be really fun, but also sometimes they might get a bit overwhelmed, okay? And that's when we need to be able to come back in on the bottom of this circle. So when we start to experience some of those really overwhelming emotions, whether it's kind of that overexcitement or some of that distress that we don't know what to do with when we're young, we don't understand, that don't make sense to us, that we haven't got words for yet, we have someone else to make sense of that for us, okay? So someone to protect and comfort us, but someone to help organize those feelings as well. So you'll often see caregivers kind of narrating how a child might be feeling. So, oh, are you excited? Did you enjoy that? Or are you upset? Was that really hard? Does that hurt? Are you feeling sad? Are you feeling scared? And helping a child build that language around emotions, but also start to associate the kind of physical feelings with their experiences, and then how to um, regulate themselves again. So if we've got someone comforting us, if we've got a parent or a caregiver comforting us, then we kind of mirror them and we use that comfort to calm down. And eventually we learn how to do that for ourselves. If we haven't had this, if we have never had someone who has let us go and have experiences, or we've not had someone that it's safe to come back to when we're upset, and someone who's been attuned to how we're feeling and able to help us organize and make sense of those, then it becomes something that we really struggle to do as we get older. And what we see then is it can be really difficult to follow this wavy line and to come back down into this safe green space because we've never been taught to do it. And so we can tend to get stuck. We get stuck in this fight flight space or in this freeze space. And again, that's when we start to see people often getting diagnoses of disorders. And it's not anything that's wrong with us. It's about what's happened to us. So the things that kind of push us up this curve to start with, but also about the things that haven't been done for us or we haven't had that make it really difficult for us to actually come back down this side of the curve back into that green space. Okay. Any thoughts or any questions on that so far? I will keep an eye on the chat. And if there is anything anyone wants to ask about that, please do so. But I'll also hang around at the end. So if anyone wants to talk about that a bit more after the session, also welcome. So please do let me know. We've had a really good point made in the chat. I'm really sorry. I don't know how to pronounce your name. Is it Milia? Who said that actually sometimes it's not just about what's lacking, but sometimes we can have caregivers who make that worse if they also haven't had that and they themselves are experiencing distress and pain. And therefore sometimes um, we can feel then as children, if our parents in distress, that we're not able to go out and explore, we're not able to leave the parent, and so it becomes less about us and more about them. And again, that's a really good point that that too can prevent us from learning how to regulate our own our own emotions. Thank you. Good point, well made. Okay, so how are we feeling and where we are on that curve will also change over time. So we have what's called a window of tolerance. Um, and it can be really helpful to think about that as a river. So sometimes you have this really wide river, right? Everything's super shallow and going really slowly, and we're all fine, right? We're in that green space because do you know what? If there's a little bit of rain, it's fine. The banks of my river are so far away, I can take it. And at other points, our river will get narrower and everything moves a bit faster and everything's a bit deeper and a little bit more chaotic. And if there's rain, I can't take it because my banks are already close to breaking. So if we get some rain, then we see a flood. Um, the example I always like to give here is being hangry. Does anyone get hangry? Yeah, thanks, Daryl. You're with me. Um, I do. I know I do. And I know if I'm out with people and it's 3 o'clock and we've not eaten yet and we're having to make a decision about where we go, I have very little patience for that. I just want to eat something somewhere, please. Um, in the grand scheme of things, that threat's not that big. It is a threat. Like I need to eat to survive. It's quite important. But if I eat at 3 o'clock instead of 12 o'clock, not a big deal. But it has a massive impact on my emotions. So if we think then about some of those other adversities that have such an impact and such serious consequences, it's no wonder that actually a lot of those will really narrow our window of tolerance and we'll spend so much more time flipping between those orange and blue spaces, so fight, flight, fawn, and freeze, without being able to kind of come back down into that nice, safe, green, regulated space. I'm gonna skip through a few slides now because I think we've spoken about them already. I maybe should have reordered this presentation. But just thinking about what someone narrows someone's window of tolerance, it's all of those things that you spoke about before when we were thinking about what increases someone's distress. So things like adverse childhood experiences, so ACEs, which I'm sure you're all very familiar with, but I'll run through just in case. So things like experiencing neglect and abuse at home when we're young, not having a safe house or somewhere safe to live. Someone's mentioned that already. So things like living in care or being homeless. And then what's called parent and carer problems. So having a family member or a carer in the home who is violent or has been the victim of domestic violence, is incarcerated, abuses alcohol or drugs, has a diagnosis of a mental illness, um, experiencing bereavement within the family, or parental separation. And lots of us will have experienced some of these. But what the research shows is the more we experience, so particularly if we experience four or more of these, then the risk of sort of risky or health harming behavior really goes up because our level of distress goes up. So we see much higher rates of things like addiction and self-harm and some of those kind of risky sexualized behaviors, higher levels of aggression. So again, some of those things that are probably a response to kind of being in distress if we think about fight, flight, fawn, or freeze. So just to provide a little bit of an overview of what we mean by social determinants, it's everything that's in this middle box here and more. So this is not an exhaustive list, but things like having low quality housing, adverse environments that you are living in, so places that don't feel safe, there's high levels of crime, not having access to good healthcare or employment, things like income inequality, poverty, education inequality, maltreatment, discrimination. There's so many things that will kind of influence our mental health more than just kind of the chemistry that we're born with. I am going to whip through this a little bit. So again, if you do have any questions, please pop them in the chat and I'll get to them. So just to summarize then, if we think about mental health, our postcode has more of an impact than our genetic code. Not to say that our genes don't play a role, they absolutely do. And there's more and more research on things like epigenetics that looks at kind of intergenerational trauma. But there is such a big impact from kind of our social circumstances and our socioeconomic circumstances, that actually that's a really, really important place to start and consider and to start trying to make some change. And just to remind you, it's much about what you didn't get as well as what happened to you. So think about kind of that coming back down on the curve and what kind of wasn't made available to you there. So, what I'd really like to think about, and actually maybe this is something we'll come back to after the break, is to how does this fit with your practice and your strength-based working? I've got a couple of other slides, but I wonder, Pete, if it's worth taking a break now, then doing this reflection, and then maybe I can run through the last few slides at the end. What do you think?
Yeah, no, I think that works. What I would say, I've seen a lot of this content a lot over the last couple of years, and it still gets me in the feels sometimes. There's reflections on my own life and my own experiences that sometimes this stuff reduces me to tears afterwards. And sometimes I can regulate and be cool. So if you are feeling it, feel free. So I think it is a good time to take 10 minutes,
Yeah.
perhaps have a rest, get a cup of coffee and stuff. If you are feeling it, do reach out to us because there is stuff in there that you may have experienced. Then do reach out to us. Um, so what I would say in, should we take a break and come back at 10:32 precisely, or around about 10:32, and really we'll open up that space, Sean, for you to finish off that bit, and we can just take some reflections then as well, really.
Yeah,
That
yeah,
works for everybody. Yeah.
yeah, absolutely.
Okay.
I'll stay online for the next 10 minutes. So if anyone wants to
Yeah.
ask anything or talk anything, feel free to send me a message either in the group chat or you can send me a private message as well if you want to. That's fine.
Great. So we will reconvene at 10:32 ish. I'll see you all shortly.
Perfect. Thanks, Pete.